I'm Dr. Rasya Dixit. I'm a dermatologist in Bangalore. I like to make people look their best. So if it is some procedure that can make you look even more attractive, that is my favorite procedure. Today we are talking about a common problem which affects most of us. When we cross into our 25 years or 30 years, you see people who are looking more and more tired, and usually they attribute it to the lack of sleep or a weight loss or a crash diet, and they say, "Doctor, I am looking more and more tired, maybe it is my dark circles." And when they come to me, I see that what they have actually got is a loss of the facial fat which is just under the eye. This is called a tear trough, and this makes our face appear more dull, more tired, more sleepy, more sick. And treating this is a very simple 15-minute procedure, and doing this makes your eyes look more alert, more awake, more refreshed, and brings a whole change into your face. Today we have with us a gorgeous young 30-year-old who has come to us looking for a solution for her dark circles. And if you look at her, she's actually a young girl in good health. She's following a good diet and exercise regimen. But what has happened for her is there is a definite deficit or volume loss in this area. Can you see this area? This is the also called the tear trough area, or it is the area right above your middle of your cheek and right below the middle of the eyeball or the pupil. And this is actually a earliest sign of aging in most Indians, where we lose the volume in this area. And if you look at this person, we can treat this area very easily with a treatment called a filler. And we are going to go through the process of explaining to Lena how we can address this by a simple 15-minute procedure. See, if you look here, you can see that the transition from your lateral cheek area to your cheek, it's a smooth curve. Can you see here? It's a smooth curve. But if you see in the eyelid, inner eyelid area, you can see that there is a hollow. So what we are trying to do is by putting the treatment to correct this hollow, just by replacing the volume in this area using a product called a filler. This filler is actually made of hyaluronic acid. Hyaluronic acid is present in all mammals, and it is only synthesized in a lab, put into a bottle and exported to us in India, and we are using something like that to treat this under eye filler. The procedure is so simple. It is done through the single entry point, which is made very far away from the eye, and we use a very blunt tipped cannula, which means there is no chances of bruising. So it means that none of your friends or anybody can make out you had a procedure, which is an added bonus. Because it is a blunt tip cannula, you are actually not going to cause any pain to the patient. So the patient feels it's a very comfortable procedure, and then there is no actual downtime. You can actually go back to work immediately. You can put on your makeup and leave. We also tell you that the final result is going to be even better than this. It's going to hydrate further for the next 72 hours. Drink a lot of water. Avoid dehydrating activities like drinking too much coffee or alcohol, and this will give you an even better result. Now, as you can see, this procedure has taken us less than 10 minutes to complete, and you can see a completely refreshed looking Lena here. So I'm hoping that you're happy with that treatment today, and we'll see you for your follow-up after 72 hours.
Hi, I had come to visit Dr. Rasya Dixit to consult her for my dark circles. Dr. Rasya had given me inputs on how to work on my dark circles by treating it with fillers. She had done a wonderful job. I had felt very comfortable during the procedure and on the ongoing procedure. I'm very eager to look forward for the results. Thank you.